I'm going to be talking about what you can and can't eat, what's nice to eat, what's horrible to eat, the things you have to do when you first come out of the surgery, and then for the weeks after, right up to the 6th week, and the things that you don't get told that I think people should know. Cheers, and welcome to the Three Piggies pub. I haven't done a video for what seems like a very, very long time. I think it's about 8 months. I was doing a scarring video and my screen broke, which was a 4K screen, and then that's put me back a few months because I had to get a new screen, and then this happened. So if you follow my videos, I was going in for surgery on my jaw, and this was all due to having severe sleep apnea. Now this is very, very common. A lot of people have it. Some get diagnosed, some just live with it. The reason why I was diagnosed with severe sleep apnea is because going back to 2019, pre-COVID, probably about 2018, I began to wake up a lot of times during the night. I couldn't work out why, possibly 15, 16 times a night. And then when you get into that sort of phase, you think to yourself, right, I need the toilet, I better go to the toilet. And it just got to a vicious circle. So every time I woke up, I needed a toilet, because you think to yourself, oh, I need a toilet. Do I need a toilet? Well, I better go just to keep myself asleep. But that was just papering over the cracks, basically. I didn't know why I kept waking up. My wife, as you know, she'll be prodding me saying I'm snoring a lot. Incidentally, going back to about 2017, I was with a work do in London, and we was on a board a ship, and we shared rooms between our company, and I was sleeping with, and I was in the same room with one of my work colleagues, and he literally filmed me sleeping because I snored that much, and showed it me the next day. As I said, about 2019, I got diagnosed because my wife said, do you know you stop breathing while you're asleep? And that's quite common again with people that snore. When they breathe in, they're snoring. You get a lot of saliva in your throat, and you stop breathing because of it. But what I didn't know is I did it a lot and for a very long time. So I went to my doctors and said, hey, look, I'm snoring a lot, I'm waking up, and they said, yeah, that's common symptoms of sleep apnea, and we'll refer you to the hospital where they can do some tests on you to see how severe it is and what to do next. So after I go to Queen's Medical Centre in Nottingham, and I went to the sleep clinic there. They hooked me up with a system to take home with me one evening, where basically you have a breathing thing up your nose. You have a belt around your chest that checks your inhaling and breathing out, exhaling. A heart rate stickers, and a pulse thing on your finger. And basically they do that, and that is connected to a SIM card, and they can see what happens during the night. And then the next day you take it back, they run through all these results, and then they come back and let you know what's happened. So roughly a week later, they said, we've got the result, can you come in and see us? Which I did. And they said, on that occasion, that night, I stopped breathing for 58 times, of which around 25 of them was for a minute or longer. Which is quite bad. The reason that's quite bad is because you're starving your brain of oxygen, and you're not aware that it's happening. So they said, right, well, obviously there's a CPAP system, and we'll try you with that. So I think that was about 2 weeks later, and then we're still in 2019 here. About 2 weeks later, I had this system, went to pick it up, took it home. They obviously showed you how to use it. You put it over your face. It's got connected to a system that goes through SIM card again, so they can check it, they can monitor it while you're actually using it. And so I had this system on, and first night I had it on for about 20 minutes, and what I didn't know is obviously if you've got this on your face, it's forcing air into your airway, which is forcing your throat to be open. But that's pressurized air. And I've also got a condition called pigment dispersion syndrome, which is, in a nutshell, your eyeballs have got millions and millions of little holes, and there's liquid going in and out of your eyeballs, believe it or not, all the time. Now, pigment dispersion syndrome, those holes get blocked. So the pressure in your eyes build up because it can't let the fluid in and out. So that's something I've got for life. I have to take drops every night for that. I had laser treatment, not laser surgery, I had laser treatment where they puncture 4 holes in each eye to release the pressure. Now this mask caused me to get that pressure back, and what the pressure does is it makes your eyes obviously bulge. You can't see them bulging, but you can feel them being bulged. You'll get headaches above your eyebrow, above your eyes here, above your eyebrows, and I could actually see, the pattern on your eye. I don't know what that's called. Answers in the comments. I could actually see that in front of me. It's like it was superimposed on wherever I looked at. And like when you look at a light for a long time and then you look away, you can still see the light. That's the same thing, but it was the pattern of my eyes. So I couldn't wear them. I took them back. I rang them up, told them, they said bring it back in, we'll try you with the nose piece one. And that's simply just the nose piece, but again, it's forcing air up your nose. Same problem. So I took it home, did it the same night. I think it lasted a little bit longer, but I wasn't getting as much air, and it was still causing me the problem with me my eyes. So, incidentally, this is Badger. I'll tell you about all this. My pub's advanced since my last video, and it's a proper working pub basically, but in my back garden. So anyway, I was then referred to the Maxiliofacial department of the hospital, and they checked me over. I went in, and they basically told me I'd got, obviously, sleep apnea, severe sleep apnea, and I needed bilateral distraction mandibular osteotomy. I don't know if I said that right. I think it's about right. Which is basically maxillofacial jaw advancement. So what they'll do is either both or one, generally your bottom one jaw, they'll move it forward. If you have a solid bite, they will then move your top jaw forward to match it up. Now I've got a massive overbite, which is causing the issue. And what they said was my bottom jaw was overly thin. So what was happening is it squashed further back than what my top jaw did, which was putting strain on the front of my neck, and literally my neck was closing up while I was asleep. So as I was lying, so I don't lie on my back, could never lie on my back, I've got bad back. Lie on my sides, my throat's shut. And the problem with that is the only reason I woke up is because I choked. It wasn't that my body goes, hold on a minute, your throat's shut, open your mouth wide. No, I choked. So it wasn't that I wanted to breathe, it was the fact that I couldn't. So yes, so they said, I'm gonna have to have this surgery. Bottom jaw first, top jaw, and this was like a March 2019. They said what I needed to do is, because of my bottom jaw being so thin, my teeth were being squashed together. So my front teeth in particular were being forced out. So if you imagine it squashing, they've got to go somewhere, so they're pushed out by the jaw. So they said I need to speak to the dentist. They need to sort out what needs to be done, because when they do the advancement surgery, they will possibly break teeth if there's problem for them, and obviously they were. Then I got vertigo. This was after COVID, so we're going on 8 months because I was trying to find an NHS dentist. I couldn't find one. In this UK, if you're watching abroad, they're absolutely 1 in a million places you can get an NHS dentist. COVID hit, and then basically my job I was doing before COVID we had to stop, and then I went on to a different job, and then I got vertigo. It lasted 6 months, and it basically caused because the oxygen in my brain was starved that much. I woke up one night with a massive migraine. I've only ever had 2 in my life, and that was one of them. And it was that painful. I had to ring the doctors, and then they had told me to go to the walk-in centres, which I couldn't do because I couldn't move. So I had vertigo for 6 months, and I had tests on my brain and everything like that because they was worried that there was a problem with pressure in my brain. And it basically came down to my sleep apnea, which is unusual because you normally get vertigo from some sort of trauma, and I'm guessing the migraine illness was the trauma. So that put everything back 6 months, and I needed the dentist. So basically, a year later, the Maxiliofacial lab rang me up again. Oh, sorry, sent me for another appointment. I hadn't had the teeth done. I said basically I'm waiting for an NHS dentist. You seem to get them pop up, say we're taking an NHS patient. You ring them up. Oh no, we've got no spaces left. So they said, well, they could do it. They could sort my problems out in my mouth while I'm having the surgery, but they wouldn't care if the teeth taken out needed to be taken out. They would just take them out because they wanted to find the space. So it went on and on and on, back and forth every 6 months. I couldn't find one. Eventually, last year, are we in last year? I can't even remember. Yeah, last year, 2025. I gave up and decided to pay for it, and it cost £1,200. I had 8 teeth removed from the bottom, 4 from the front, and then 1 from the side to create this room for this surgery to happen. Hence why you can probably see on the camera now. It wasn't nice. I don't really like the way it looks. I've got a long way to go to sort this out, but it was needed to be done. Roll on to February 2026, and I've got my appointment date. It was a Tuesday. I had a Monday off work just so I could concentrate on what I needed to do rather than not be concentrating at work. I was booked in for 10:30 on the Tuesday morning. You go in and you have your pre-op discussion. You have that beforehand, by the way. You have a pre-op assessment beforehand where they'll go through all the conditions in your family, things like that, and anaesthetics and stuff like that. So I had my pre-op discussion with the surgeon and the anaesthetist because it's a general anaesthetic. They talk through what's going to happen and how long it might take, and then recovery straight after and where I would be afterwards. So I was never really told how long I would be unable to do things, and more to the point, how long I would need off work. During discussion previous, I was told it would take 2 weeks. So what my idea was, maybe this is one of the things you should speak to your surgeon with, but when you have the surgery, you don't just have it. So you don't go in, have the jaw advancement, come out, recover. The jaw advancement is a process that you do when you get home, and I'll come on to that in a moment. So I was expecting him to say, you'll be out 2 weeks, maybe 3 weeks, and you'll be back to work, which is what I told my work. No, it's a minimum of 4 weeks. Generally, it takes 2 months to recover enough to go to work, depending on what you do. Now, I don't really speak a lot on phones, but what I do is there's a lot of discussions going on in the office, and they told me to not talk so much, which is impossible when you're in an office, because you can't communicate properly. And even though you can email people, and obviously you've got text to speech on phones and like that, when you're so used to talking, you can't. So yeah, 6 weeks, 2 months, and this was before my operation, and I was like, wow, okay. So I've had that. I go back into the waiting room. They said I'm second in, I think it was. And I remember vividly that this guy came in about an hour later, and his name was the first on the board. So I got the impression that he would then move to the last person, and then it doesn't work like that. He was still the first person in, and then that means every other surgery's pushed back. Now, depending on what you're having done, there's obviously so much time that they can do surgery, and it got to about 4:30, so I'd been there 6 hours, and the sister, or the nurse, head nurse, I don't know what they call them nowadays, she came to me and said, unfortunately, they're going to postpone your surgery because they've oversubscribed, and there wouldn't be enough time for my surgery to be done, which was annoying, frustrating, because I've been there for near on 7 hours, and you know, you go into surgery and you're thinking about the surgery all the time for 7 hours. You can't eat, you're just sipping water all day, and you're not allowed to like really guzzle the water, it's sips. So I was dehydrating myself, I was hungry, obviously frustrated, annoyed, so I just said, well, I'm going then, alright, thanks. And she said, as I was going, that the doctor would be in touch to tell me of a new date. Now, I was thinking that would be 2, 3, maybe a month away, because it was 6 months from my agreement to go do the surgery till I had the surgery. It was actually the Friday after. I got a phone call on the Wednesday afternoon, because I was going to ring up and say, look, you know, I need to tell my work, because I was off. I was booked off sick at that point. I need to tell my work, do I go back in? So they said, oh, you're in Friday. Come in for 10:30, and you'll be the second person in. And I was like, oh no, I've heard this before. So I went in on the Friday. The first time I went in, I was in a big waiting room. Second time in, they went, right, go straight into the ward rooms where the beds are out, and we'll tell you to get changed when you need to go in. And obviously they give you the gown and everything. So I think I was there about an hour and a half, give or take, and the woman come in and said, can you get changed now, you're ready to go in, you'll be about 20 minutes. So I was like, wow. And this, I think, was just going into the afternoon, and the guy came with a trolley. I was already in my gown, and he pushed me down the ward. Now, unfortunately, from where I was in the waiting, it was literally to the side of the hospital, so I was wheeled through basically the whole hospital, past the front desks of the main entrance where they cross the coffee is, and then all the way down to the bottom floor, where they push you into the pre-op room. I don't know what it's called now. Is that called a pre-op room? And basically, it's all in the QMC's case. You've got pictures on the wall of nice fluffy clouds and trees and fields and that. Unfortunately, they didn't push me far enough in, so all I had a view of was a curtain and a machine, which I was trying to read, but my eyesight's not great. So I spent 25 minutes trying to read something on the thing, because you're waiting, you're like, I can't see anything, no one's coming past, I don't know how long I'll be here. It was about 40 minutes in the end. I was just sat there looking at the roof, and I was pushed into the anaesthetist room. So they go through all your details, make sure that they've got the right person, and tell you what they're going to do, tell you how long the surgery is, which was going to be 4 hours. And then obviously hook you up to all the machines. I've never been put under before, so it was a new thing for me. And they obviously put the is it half catheter or something? No, that's catheter for your bit, whatever that is. It goes into your wrist. Puts the liquid in, says you're going to go a bit dizzy, might feel a bit nauseous, and then gradually it'll get worse. I felt more nauseous than dizzy, so he puts the mask over my face with the oxygen, and obviously they increase at that point, and I felt really sick, and then that was it. I'd gone asleep. Now I've watched videos of this, because you tend to do things like that before surgery, and basically you're not breathing for a certain amount of time. Most of the time they for general surgery they put a tube down your throat into your neck to force the air down. Now, because obviously I was having jaw surgery, they couldn't do that, so I had to go through my nose, and they did warn me that I might get cuts in my nose because of the pushing the tube down. It's got to go down my throat. Obviously you don't feel any of that, and that was that. I forget what time I came out. I think it was about 9 o'clock. I didn't have my phone because obviously it was in my belongings, and I went into the recovery room. I think it was about 7:30 actually, but just less than 7:30. I went into the recovery room and said it took 6 hours because they had to break my bottom jaw, put steel plating to reinforce the front, because of them moving it forward, because it was so thin. They needed to just give it a bit more strength, so it took longer than what it's supposed to. They then put this mask on my face over my jaw, which was actually connected to a refrigerator unit, which was pumping cold water all around my face constantly. Obviously I have the morphine, I have all the drugs that's going into my hand to stop any pain. Didn't feel any pain. I couldn't see myself, obviously, because I'm lying on the bed. They come around, check me. I can feel bags here. I can see bags here on my shoulders. I'm not sure what they are at that point. And I was there for about 45 minutes, an hour, before my bed was ready in what they call an EPOC room, which is basically enhanced care. So basically you have a nurse to every 2 people, and the room will only have a maximum of 10 people. So it's now like evening time, 9 o'clock. I get wheeled into this room. The nurses are brilliant, absolutely fantastic. My thought was how long I'm going to be here, but obviously I've got all this on my face, so I can't really speak. They just said I'll be looked at in the morning by the surgeon, see how it went. Because it was on a Friday, and then on a Saturday they shut the EPOC room, so I couldn't stay there anyway. So at the afternoon on the Saturday, I'd have to be moved to a ward if I was to stay in. So the night I went through, I didn't eat, obviously, because I'm fresh out of surgery. They say they give me a bed bath, make sure I was all right. Then basically, because it was so late, this basically started switching the lights on. Now, I'm not a very heavy sleeper. I'm a light sleeper, so noises, I knew were going to cause me a problem. The nurse was absolutely brilliant. As I said, they were quiet. All the lights were out basically, apart from the ones so they could see where they're walking. Shuts my eyes, and all of a sudden I got snoring noise. And it wasn't just a snoring noise. It's one that just kept getting louder and louder and louder. And it turns out the guy next to me who was in, he had lesions removed from his stomach. Because of how the surgery, I had to sleep a certain way, and he snored all night until about 5 in the morning. So I was awake till about 5 o'clock in the morning. And when he did stop, randomly, he switches his phone on, and I know it's Sky News because I could hear the music for Sky News, and it's so loud. So the point he does stop snoring, he turns his phone on loud. So I had to shout, I literally shouted in my bag of mouth, "Excuse me, shut up." And then the nurses came down and told him to shut up, and then I think about 6:30 I woke up, and at that point I remember the bloke next door talking to a nurse and say, "What's he in for?" And the nurse said he's had sleep apnea treatment, and he said it didn't work. Like, he's been snoring 5 hours, I manage an hour and a half, and he's the one that's complaining. So I'm thinking now, I'm like, oh, if I have to go to the ward, please don't put me next to him. And luckily, after the surgeon bloke came, he came and says, not the main surgeon, but one of the surgeons, he came and says, we'd like you to go home, you recover better at home, but the head surgeon needs to, have a look, make sure things are right. Now, basically, in a nutshell, I've got 2 rods sticking out my neck. I don't know if you can see I've got a lump there still with a mark, and there's obviously one. They're both sticking out my neck, about, I want to say, at least 2.5 inches out my neck, and I've got 2 plastic bags over what they call rods, which was there to collect the blood that was coming out, because obviously there's holes in my cheeks, into my jaw, and there's blood in the bags. So he said he needed to check them was all right. There was stopped the bleeding, and there was no swelling at the site of the entrance of the rods. So I goes, well, that's great. I don't really want to stop in. I'd want to go home. And he says it'd be good if you could go to your toilet yourself, because there was discussion I might have a catheter on, but because I recovered so well, I didn't need it. So I said, yeah, fine, I'll go and have a wash. Actually, I feel like I want to wash. So this was like, I want to say about 8:30 in the morning. I said, right, can I go for a wash? And they said, are you sure? Yeah. I said, can I have some towels and things like that? And I went down to they've got a washroom. I didn't have a shower because obviously I've got these bags on me, so I just had a face sort of body wash. That went fine. I had a change of clothes, or change of pants even, and then obviously I had to put the gown back on for the test. I went back in. I said I rang my wife up. Said, look, I think I might be coming out at 10 as long as the surgeon's all right. I should be coming out. Just before the phone call, the woman came round with the breakfast. I could only have yogurt, and I had to drink through a straw. So yeah, I was on the phone to my wife. I put the phone down. Well, you don't actually put the phone down anymore, do you? Press a button. Press the button on my phone, and I went to go to have my yogurt, and I suddenly felt really, really dizzy. And it was like going up, like my face. And luckily, where I was, I'd got the alarm thing next to me, and I felt myself go. I pressed it, and the next thing I got people tapping on my shoulder saying, "Am I all right? You'd been out for a couple of minutes," and I goes, what it was is because I had to take the mask off to have my wash, and then one of the nurses came and put it back on, and when he put it back on, he put it over because it goes over the spike, it twanged the spike, which obviously is connected to my jaw, and it's obviously gone bang, and there was just some sort of shock there. My body went into shock without me knowing it, so I passed out. And here's me then straight away, oh God, I'm not going to go now, I'm going to be on a ward. But surgeon came, and said, no, you're fine. I want you to go home. You can recover better at home. You can watch TV yourself. You ain't going to be worrying about any diseases or whatever you have in hospitals nowadays. So I managed to go home. I got changed. My wife came and picked me up. I was actually wheeled down to the car because they said because I'd passed out earlier, it was more safer to be trolleyed to my car. So I was trolleyed to the car. So then I'm at home. So you have to sleep sitting up. So most people beds, I don't think it's common knowledge that your bed's not really meant for you to sleep upwards. So I thought the best thing would be do is I've got a sofa. I'll sleep up downstairs on the sofa with pillows behind me to keep me up because I've got a wall behind me, and that's what I did for 3 weeks basically. So I'm going to go on to the food types of things now. Now obviously you're drinking through a straw, so you can't have a lot. You've got to have, to start with, for the first week, liquid all the time. So liquid soup, so your chicken soup without the chicken bits, yogurts, chocolate shakes. You can also have things like semolina, rice pudding, Weetabix ready break, but you have to blend it into a paste basically, so you can suck it up with a straw. Now you can, obviously, I'm not going to tell you how to suck through a straw, but you can get bigger straws and it's a lot easier to do. It gets very boring very quick. Oh, I can have tea. You've got to, don't have hot tea, you've got to have warm. Everything's got to be warm, not hot. So tea, coffee, you're fine with stuff like that, milk. But it gets very boring very quick. And I was getting frustrated just having the same things over and over again. I'd already had my next appointments planned in, so that there's like 5 appointments booked in. So one a week straight after, and then another one 2 weeks after that, and so I've already got the plans in. And the first one was to start the turning of the rods. Now the turning of the rods is to move your jaw forward. So as I said before, it doesn't get done in one go, it's done over time. Now the reason they do it over time is because they don't really know how far to do it to help you. So what you do is you get your jaw turned, and then you have the sleep equipment put back on, and then they test you, and then you go for that. You try it again for 3 or 4 more days, sleep equipment, and then so all these appointments are booked in advance. So I go for the first turning, and luckily my wife's there because they've got to do it. You got to do it at home, and I don't go back to have it done because I'll be going every single day. So what you do, you've got these 2 rods. They give you like a tool that's similar to a reverse version of what you get to do ring doorbells. They're funny star things, but it's a reverse version. You push it onto the rod and you do a full turn. Now it's got a little line on it, so you push it in with the line on and you keep turning until that line goes all the way around. So the first time I was there, because I was a day behind apparently, they had to do it twice. And each full turn is, each 3 full turns is 1 millimeter. So the first time they did it, they obviously did it 2 full turns, and that wasn't quite a millimeter, and I had to do one on the night. The first time they did it on one side, I can't remember which side it was fine. I was absolutely fine. You get the pulling on your cheeks, because obviously your cheeks are trying to heal and they're twisting something in your cheeks, so your cheeks do drag. Not a lot, it don't hurt, it's just a funny sensation. And they did it both sides, and I was like, right, brilliant. And then I got dizzy again. I didn't pass out this time, luckily enough. I just went pale as a sheet. Luckily I just had some water and it was fine after that. The nurses at the thing called Maxiliofacial, and they basically told my wife how to do the turning. She wasn't happy about that because she's squeamish, and sometimes when you do it, a bit of blood comes out. So obviously I forgot to tell you a while back. So after I've come out of the surgery, they took the bag off. So the bags aren't there. I've just got these things sticking out. Should have said that. So I get home. She does it that night. It goes on for 5 or 6 days. I've had the sleep equipment on during this time. As you get closer to the 1 centimetre, which is where I stopped, you do start to feel the pressure on your jaw, because obviously it's moved a centimetre forward, and you obviously your skin around your mouth, your gums are all starting to stretch. So you do start to feel it then. It's just a very strange feeling, and sometimes it's a bit sore, but it's nothing painful. Once you've had it done, it's gone within 10 seconds. It's not that bad. It's more I think it's more pain for the person doing it, because you can hear the clicking when it's going through the extending. So I did a week's worth, and they said from my tests I'd gone from 58 times a night waking up down to less than 10, and stopping breathing I'd gone from 40 down to less than 3. So that's good enough. The average person will stop breathing 3 times a night, so that's bang on basically. And they said, right, a week's time. So we stopped the turning. Week's time, they get the rods taken out. Cheers again. Gets the rods taken out. So these rods are basically they've got like it's a circular piece of metal with like a screw inside. So that thing that you're turning is a screw going through this rod. So the rods don't really physically move, but they do get the pressure of the move. So they take the rods off. They've got this thing that comes out first, which is attached to the screw. You'd think that it would then swivel back, but apparently it's like a locking thing, so it'll get so far, and once you stop screwing, it will lock, so it can't click back. Takes the rods out. I went dizzy again on the second one for whatever reason. First one was fine, maybe it's because there's 2 of them, and I became tachycardic apparently, and they was going to admit me, but I just said, can I have water, I'll be fine, and I was, but they wanted me to stand up and have my blood pressure tested, and my blood pressure was I think it was 105, but my heart rate was really high, so or my pulse rate was really high. So basically my body was trying to pump the blood round, but it wasn't doing my heart as much, so that it was struggling. I was told not to take blood pressure pills, which I hadn't anyway, because obviously I was on blood pressure pills. I was on losartan, 40 milligrams. Pre-op, I'm glad to say now I'm not on them at all, and I'm averaging around about 118 over around 80, which is perfect, where I was high end 140s, 90s, 95s. So I was, what would they call it, class 2, I forget what this called, but I was at the orange and everything basically. So so that's been taken out. They've taken them out, and I then said, can I start eating better? And they say, yeah, but you can't chew anything. So I've still got to be careful what I eat. So I'd gone from the straw to a spoon, and so I can start eating things like rice pudding, proper rice pudding that's got the bits in, and things like that. I've actually drawn it, because I wasn't told much about what I could eat. I've worked out a list of things on my piece of paper here that you can actually have, that fills you up, and it ain't just soup. So once you can start eating soft diets, what they say is you need to be able to eat it by crushing it with your tongue on your roof of your mouth. So if you can squash it with your tongue on the roof of your mouth, you can eat it. So here's a menu for you for things you can eat. Scrambled egg, or pretty much any type of egg. Scrambled egg, poached egg, fried egg. You can even quite manage your hard-boiled eggs at a push, as long as you can squash it down a lot. Some things you might not like. You can eat blended sausages. I didn't like that. You blend it down into basically a paste, and you can swallow it. Mix it with the egg. It's better. Tuna, obviously. Tuna, fish, anything like that. That's really soft. Again, if you can crush it with the top of your mouth, it's good. Chicken, not roasted or anything like that. Boil it, and you can mash it with your fork. So it's like pulled chicken, I suppose. But don't just leave it long strips. Cut it down into things you can just swallow. Potato mash, great. Pancakes, yeah, pancakes. You roll them. Not the American style ones, the long ones, like the British style ones, and make sure you cut them down into bits. That's better because you can choke on longer bits, obviously. Corned beef. Some people don't like corned beef, but it's very easy to mush up in your mouth. Stewing steak, obvious reasons. It's basically braised beef or braised steak. It's supposed to melt in your mouth. So curry, curry with rice. Again, sometimes if you microwave curries and things like that, you do tend to get hard chicken. So what you need to do is, if you can't squash it down with a fork into a flat thing, you're gonna have to blend it. So you lose stuff there. Now, what I'm saying with the blending, so one night, bless her, my wife made a roast dinner. She made roast pork, potatoes, veg, and she mashed it all into one. And it, for me, I mean, that might be fine for people, but for me, in a mash, basically, it was just too much flavour in one mouthful. Everything tasted like the pork. So if you like that stuff, so going on from the pork, bacon grill. Some of them are good, some of them are bad. I've had two kinds. One of them was too hard, one of them soft. And if you lightly fry it, you do get the flavour in then, and as long as you can squash it with your tongue, bang on. Spaghetti cut down into 1 inch bits, enough again to swallow. Noodles, 1 inch bits, so you can swallow. There's a thing called orzo pasta. A lady from my work told me about it, and it's really good. It's like rice, but it's pasta. So it's so easy to swallow. So you can mix that up where you get some chicken in white sauce with your pasta, stuff like that. As I said, rice pudding, custard, yogurts, cream cheese. Sometimes you might want to mix that with milk because it's quite congealed and it can get, you know, a bit in your throat. So where I'm at now, I went back on Thursday, and so my jaw's now joined back up again, but it's not fully formed, so it's quite soft. So I've got another 2 months of waiting where they will assess whether they can take it out, basically. I've heard that sometimes they don't. The only reason I'd want it taken out is because this here on this side here, not so much this side, it sticks out, and I bang it. So when I'm washing as well, I bang it. So I'd rather have it taken out. So I've been told when you have it taken out, the recovery, it's done. You probably go back home the same day. Removing is not as bad as they're putting in because there's less cutting. The swelling's still there. You may still have to have a mask, but you should be able to go that day as long as you get the first thing in the morning, and then you could go probably late afternoon, evening. And the recovery time, I'm told, is roughly 2 weeks, two to 3 weeks, because your gums aren't going to be fully healed, because obviously they've taken things out. So 2 to 3 weeks. I will update you on that, because I'm now 2 months away from it. So to have that out, and when I went in, you told me I could now start chewing soft things. So the first thing I had, where I had to chew it, I did have a McDonald's Big Mac yesterday. Just a Big Mac, no fries. Fries are too hard. So basically, when you're at this stage where I'm at, you can eat anything where you don't have to put pressure on whatever you're eating. So pasta, it's got to be really sloppy pasta, not al dente pasta where you have to crunch it. No apples, no beef steaks or anything like that. Nothing that where you have to put proper pressure on it. You've got to be able to just put it in your mouth, close your mouth, and it sort it out. Well, I've had hot dogs in burgers. Hot dogs in buns, not hot dogs in. And I'm feeling a lot better about myself, because, as I said, things do get boring when you're eating the same things over and over again. And sometimes I wouldn't eat because it was just getting on my nerves. So hopefully I'll give you a bit of insight, because I was never told anything properly. And I suppose it's because I didn't ask, but you would think that they'd tell you the sorts of the time you're going to be off, what the process is, what you're going to do after. I just thought it was done in one thing, and there you go, you're out the door. But it's not. It's a 2-month process, and after that you're still 3-4 months off being fully done. What I will say is I've stopped snoring. As I said, my blood pressure's come down. I don't need to take cholesterol pills anymore. I've got more energy. I used to be falling asleep. As soon as I got home from work, I fell asleep. I've not done that since. Admittedly, I've only been back at work 2 weeks, but I've not fell asleep. I've got more energy. I want to get back into walking. I used to walk loads, and I want to get back into YouTube. I would like bottom teeth, but that's a bit far off yet, because that's going to be another grand. Hopefully you will have teeth that are all right. Mine were brittle, so and my jaw wasn't strong enough to go through the surgery and keep my teeth. But hopefully you're not that way. Hopefully your jaw's a bit wider. So in a nutshell, I didn't feel much pain at all afterwards. It did take longer than what they said it was going to take, because they had to do more. The recovery is frustrating rather than painful. I had codeine given to me, and I think I used it for about 3 days, and that was it. But I'm happy now, so now I can start to chew things ish, and obviously I can drink beer. I drink beer pretty much a month after, but it's not bad, and it really does work. So hopefully I've helped you there, because I couldn't find any videos about it. So hopefully you have some insight in what happens, and it's not scary, and it does work. So best of luck to you. I'll see you. I will do another video of all this round here, because it's a lot different to the first video. So I'll see you soon. Cheers.